the most elderly and with people in care homes, and of course their carers, to make sure that others don't catch it. And then essentially it comes down the age range. NHS staff are also high on that priority list. And also the clinically extremely vulnerable, who we've supported throughout this crisis, those who are particularly vulnerable to coronavirus.
Well, Paul Hunter is an epidemiologist and professor of medicine at the University of East Anglia. Paul, great to have you with us. I mean, this is an extraordinary scientific achievement, isn't it? Did you think that it was possible in such a short space of time?
I think certainly we were hopeful of that, and I certainly believed even months ago that we would have a vaccine perhaps early in the new year, but to have one before Christmas is a really big thing, and one that I was very excited to hear about this morning when I got up.
So 2 jabs, 21 days apart. Do we know how long immunity will last after that second jab?
No, we don't for certain. I think it's almost certainly going to be the case that it lasts at least a year. Hopefully it will last longer, but if it doesn't, we may well have to have repeat vaccinations, possibly on an annual basis, for at least some time to come. Often when a new vaccine is released, you tend to assume that it won't. You tend to assume it won't last that long, and you give booster doses. But then, as evidence builds, you can say, well, actually, maybe some of those booster doses were not necessary. But I think we're going to have to play it safe in the first instance and assume that we'll be vaccinating people on an annual basis. Hopefully, that will prove to be overcautious, and we'll be able to extend that as time goes by.
Right, and we've already heard from the Prime Minister that it's going to take some time before the rollout is complete. We also know that there's a section of the population who will choose not to be vaccinated. So, in your opinion, how long is it going to be before the population as a whole benefits from the protection of the vaccine?
Well, I think the way that the government's rolling this out is that we will start to get benefits actually very early on, because there are 2 things that you're wanting from a vaccine. One is to actually, if people are infected, that they don't then become seriously ill, they don't need intensive care, and hopefully they don't die from their infections. The other thing, and we know that is a given with this vaccine. The other thing is we're not entirely sure whether it actually stops the transmission of infection. Whether if you're infected with the and you've had the vaccine, are you still going to then not have an infection that you can't pass on, or is there going to be a mild infection that you may still be able to pass on? So there are some things around there that we still are not entirely sure about. However, as soon as people start being vaccinated, the number of people who are likely to get severe disease will decline, so that if we're vaccinating the people most likely to die, it's not going to be very long before, in that age group at least, death rates start declining. And we will see benefits starting to appear a month or 2 after the programme. But those benefits will build as more and more people are vaccinated.
Can I just ask you very quickly, the way this vaccine was developed, the speed, the collaboration, the processes put in place, will we now see similar efforts applied to vaccinations for other diseases in future?
I hope so, but it does depend, and it depends in part on the nature of the disease that you're looking for. One of the I'm going to say benefits, but really it wasn't that much of a benefit, was that we actually had large numbers of cases of COVID occurring in recent months. And because of that, we were able to demonstrate the effectiveness of these vaccines a lot sooner than we would have had if it was a disease that wasn't that common. The delay in vaccines coming to market often is because you have to wait a very long time to have enough people who are exposed to a particular infection to prove that it works, and the fact that we've had so many cases, which has been dreadful in recent months, but it has meant that we've been able to prove that these vaccines are effective a lot sooner than we might otherwise have been able to.
Paul, thank you very much indeed for joining us. Paul Hunter there.